Hi everybody, we're back for another episode of Tooth Time with Dr. Aimee, and today's episode is brushing. So hopefully we can answer the who, what, where, when, why, how of all your brushing questions, and let's get started. So who needs to brush? Everybody. You guys need to brush, your kids need to brush, we all need to brush, that's important. So hopefully that's an obvious one. What do we need to brush with? So we can brush with pretty much anything that works depending on their age. So little babies that just get a tooth in, you could start with something as simple as a corner of a wet washcloth. Wet it, put a little bit of toothpaste. You could do one of those finger brushes. You could do a little rubber brush, regular toothbrush. For the older kids, electric toothbrushes are great. Really, whatever they'll tolerate is awesome. And besides what as a toothbrush, what should we put on it? So, believe it or not, the American Academy of Pediatric Dentistry, their guideline actually is to start using a fluoride toothpaste as soon as the first tooth comes in. So, if your pediatrician has told you, just brush with water until they're 2, that's kind of old school thought. It used to be years ago a guideline, no fluoride toothpaste before 2. But especially in areas like us here in Greater Westfield area where the water is not fluoridated, you do want to be using a fluoride anti-cavity toothpaste. And the guideline states as long as it is an age appropriate amount. So what is that age appropriate amount? If they are under 3 years old, that age appropriate amount is going to be a really little bit of toothpaste, just the size of like a piece of rice, a tiny bit, just like a smear on the bristles, just enough to cover the bristles. Then as they get older, over 3, and even as they get older, even like our age, anybody really, you don't need a ton of toothpaste covering your toothbrush. Just enough of like a pea size, a little green pea, will give you enough of that anti-cavity benefit. So just be, conscientious of when you're getting toothpaste. Make sure it has fluoride in it. Tom's makes both fluoride and non-fluoride. There's lots of same thing. Orajel has training toothpaste. There's really not much of a need for those type of training ones as long as you're using that age appropriate amount. Because if they swallow it, as long as it's that safe amount, nothing's gonna happen and they're still getting that anti-cavity benefit. And obviously as they get older, they'll be able to swish and spit and everything, and you really don't have to worry. Who, what, where? Where should we brush? Anywhere is fine. Obviously, when you think about brushing, you think about brushing at the sink, in a bathroom, but that doesn't have to happen. You could do it in the bed, in your kid's bed. You could do it on the floor. Really anywhere that they'll allow you to kind of get it done and get a good job. If they're older and they're capable of standing at the sink and swishing and spitting, then obviously keep it in the bathroom. Keep that mess there. But otherwise, floor or bed is totally okay. When should we brush our teeth? We should brush our teeth morning and night, twice a day. So ideally, and it should be for 2 minutes, 2 times a day. With the younger ones, if the attention's just not there, they won't let you get in there for a full 2 minutes. Try to get through a song, try to get through as much as you can. Get the teeth, get the gums, get the tongue, little baby circles all around, massaging the gums, making sure you get insides, outsides, fronts, backs, tops, bottoms, all around. Yeah, so where were we? Who, what, where, when, why? Okay, well, hopefully why is an obvious answer or obvious question. Why do we brush our teeth? Because it's important, because we don't want to get cavities, because we want to have good oral hygiene, not stinky breath, right? PU. It's actually a really important connection between the oral cavity and the rest of your body. That systemic connection is important, so maintaining good oral hygiene helps to have a happy, healthy rest of your body as well. And lastly is the how. The how is, how am I supposed to get my kid to brush their teeth? How can I get my baby to brush their teeth? How can I get my teenager to brush their teeth? They never listen. So when they're older, the nagging kind of has to be just reminding them, or when they're, elementary, middle school, incentivizing if you have to do a sticker chart, things like that. And for the younger ones, helping that, it really should be, they can do it independently. I'd say, obviously depending on what your dentist says and how good of a job they're doing. If they are 4 and over, and they're doing a good job, mornings, usually we tell our patients, like, all right, you could do it by yourself in the morning, but at night, you do it yourself, and then a parent has to help go over it. So that's a really good way to make sure that they're going to bed for all those hours at night where the saliva is not really flowing as much, with clean teeth. Same goes for little kids, little babies who are having milk at night. Even if they get super sleepy, I don't care. You need to brush. I don't want to see cavities that young. It hurts when we see it that young. So if it's something as simple as a little bit of toothpaste on the corner of a washcloth, they're half asleep, you're wiping their teeth, wiping their gums, getting that milk off their tongue, so this way they can go to bed the rest of the night with a nice clean mouth. The way we really recommend doing the younger kids is what we call lap to lap. So for lap to lap, we're going to bring Dr. Frank in. And by the way, we're recording here from Fort Frank. Our son is napping, so we had to be extra quiet. We have a little baby here with us today, and we could pretend that, he's a little bit bigger, but ideally for lap to lap, you're going to straddle the child's legs around you, even if it's like a 4-year-old who's just having a really bad day and does not feel like brushing at night, we still need to get it done. I really need you guys to make sure these kids are going to bed with clean teeth. So lap to lap works when they're just not having it, or they just, want mom and dad to be there, or whoever. So you're gonna, have one parent, or whoever's home with you, or you can honestly do it by yourself sometimes. Sometimes I have to take my leg, or when our little guy was younger, and just put my leg over and get it done. So you would lay the baby back or the child back from one parent's lap into the other, and then the parent who's holding the child can hold their hands, so that way they're kind of supported and they also get to see the parent. And then the other person can take the toothbrush and get a good look. And if you have to get your finger in there to kind of help crank the mouth open, you could do that. Make sure you get behind the molars, so that way you're not getting bit, you're getting behind the teeth, getting them open, brushing all around. And then when you're all done, sitting them up, lots of positive encouragement. Great job, you did amazing. And and that's pretty much how you can do. We do that actually often in the office for first dental visits, when they're really not capable of sitting in a chair by themselves at that age. So that works as well. Brushing is a big topic, so we're going to end it here. But if you have any questions, any personal thoughts or things that you want to share, please message me. I'd love to get back to you guys. Happy Monday. Hope everyone's doing good, staying well, stay safe. Bye.